All right, Mike, thanks. Expectant mothers always want the best for their babies, but how does their dental care factor into having a healthy baby? Because health matters, we're joined by dentist Steve Mangan this morning to learn about how caring for your teeth can affect your pregnancy. And here's the big question: should pregnant women still get their teeth cleaned every 6 months?
Absolutely. Well, and of course, the whole 6-month thing's greatly dependent upon what kind of condition they're in to start with. So, but the thing is, I guess the big question that people ask me is like, oh, I'm pregnant, and my wife, by the way, is currently pregnant, and I'm thinking, okay, do I tell my wife, who really still doesn't like getting her teeth cleaned, yeah, you still need to be regular with your dental care? And the answer is yes, you really should.
Because there are actually some more risks that pregnant women have.
Absolutely. And there was a study done some years ago, and they determined that one of the biggest factors that was kind of associated with preterm labor was periodontal disease, gum disease. And just a little bit of checking, they started doing a little research, and they found out that one of the main things that causes the uterus to contract when you go into labor are prostaglandins. Well, these little substances that our body produces are also produced when you have periodontal disease.
So there's a direct link from your mouth to your uterus.
Absolutely.
Who knew?
I know it.
And I've heard this. Tell me if this is right, that there are actually, maybe more calcium, more plaque in your mouth when you're pregnant?
I think that probably the entire chemistry of your body when you're pregnant,
everything gets
really
thrown out of whack.
Hormonal changes. You tend to get a little more gingivitis just because of the levels of hormones that you're circulating when you're pregnant. And it's probably something that everybody's worried that, oh, when I go get my teeth cleaned, my teeth bleed, maybe I shouldn't do that when I'm pregnant. But just the opposite is true. You need to keep your mouth particularly clean while pregnant to keep those hormone levels and the levels of the chemicals that cause uterine contractions. You want to keep those low, so you need to go ahead and...
Real quickly, what about x-rays and fluoride treatment?
Okay, well, x-rays are probably going to be kept to a very minimum if you're pregnant.
So only if you have to?
Well, yeah, if you've got a severe need, we block out everything that might get to the baby, and it will probably be fine, but probably going to avoid them. And then fluoride, I'd say that probably you want to avoid ingesting a lot of fluoride. Topical fluoride, like getting your teeth polished when you're getting clean, probably not going to be a factor. Okay, sounds good. Thanks for clearing this up, and because your wife is pregnant, you have to get it right. Thanks a lot, Steve. Well, still ahead, why Kohl's is now offering more than just another sale, a controversial hearing on the radicalization of American Muslims.